Good afternoon. I hope everyone is well today. I appreciate you all being here at this press conference to really talk about the evolving crisis that we are facing in Arkansas with pharmacy reimbursement and patient access to pharmacist services all around our state. I'm Scott Pace, and I serve as the CEO of the Arkansas Pharmacists Association. I'd like to first begin this press conference by thanking Governor Hutchinson for his press conference last week on this very important issue, where he announced he would be calling a special session of the legislature to address the crisis that's affecting patients and affecting pharmacists throughout the state. Mr. Governor, the pharmacists of the state and their patients appreciate your strong leadership on this issue, and we thank you for your commitment to calling a special session. I also want to thank the countless members of the Arkansas General Assembly who have worked tirelessly on this issue. Many of you have heard Senator Caldwell and Representative Gray's name used repeatedly, but what you need to know is that there are absolutely an unnameable number of legislators that have been working behind the scenes on behalf of patients of the state of Arkansas and on behalf of their pharmacists. This crisis, as you know, involves the health insurance plans operating in the health insurance marketplace. This crisis calls for immediate relief for the pharmacist and comprehensive oversight of the pharmacy benefit manager middlemen that stand between you, the patient, and your pharmacist. The health insurance marketplace is a vital part of the way that hundreds of thousands of Arkansans access health care insurance in our state. The importance of this program, including Arkansas Works to our state, cannot be overstated. Our hospitals rely on it, our doctors rely on it, our pharmacists, and most importantly, our patients rely on it. But this program needs to work for everyone. But for the marketplace to work, there must be sufficient competition and there must be sufficient transparency. At the first of the year, it became apparent that the transparency that is needed is severely lacking, specifically in the pharmacy benefit space. On January 1st, the health insurers and their pharmacy benefit middlemen dramatically cut the reimbursements to the pharmacists that provide care around the state. These cuts resulted in many patients being turned away at the pharmacy counter, not because the pharmacist didn't want to serve them, but because the insurance reimbursements simply didn't cover the cost of the medications. In many cases, the pharmacists took care of their patients while taking large losses on their medications. Pharmacists take care of people, folks, and that's what they try to do. But the pharmacists were ultimately faced with a challenge of taking large losses or turning their patients away, simply because of the actions of the insurance companies and their pharmacy benefit middlemen. I'm going to give you a specific example. In Stuttgart, a rural rice-producing town on Arkansas's Grand Prairie, an epileptic patient in his 50s who lives 10 miles away in a little town called Humphrey, doesn't have a car, doesn't have a caregiver, he can't read or write. His day-to-day caregiver is his community pharmacist in Stuttgart. That gentleman has a seizure disorder, and the only medication that he takes to control his seizure disorder is provided by his local pharmacist. After the first of the year, that pharmacist was faced with the issue of having to lose $25 on that prescription to take care of this gentleman's seizure disorder, or let him face the real possibility of going to the emergency room, or worse yet, end up in the hospital. That is not a choice that any healthcare provider, and that is not a choice that any patient should be faced with. This exact situation has been replayed across the state countless times since the first of the year, with losses mounting with Arkansas Blue Cross, Ambetter, and Qual Choice, and the PBMs that service them. The situation is unsustainable and it requires a fix. We are so thankful that the governor recognizes the need for the fix by asking for a special session. It's an important step. But there are two meaningful components that must be addressed. The first is an immediate fix that allows patients like our aforementioned epileptic patient to be taken care of and for the pharmacist to be able to make a reasonable profit to care for their patients. The insurance carriers and their PBMs must step up and offer a meaningful solution to this healthcare crisis around the state. Up until now, the pharmacists have literally been taxed by losing money to take care of their patients. This must end. Make no mistake, this is not a situation where the pharmacists that you see around you simply want to make more money. This is a situation where the health insurance companies and their pharmacy benefit managers don't even cover the cost of the medications. I implore these insurance companies and the pharmacy benefit managers to do the right thing and bring a meaningful fix to this problem. Secondly, we need to bring meaningful oversight to the pharmacy benefit manager community for all of the patients in Arkansas. And we want this to happen in a special session. When the fox guards the henhouse, all sorts of games can be played. And in Arkansas, with the PBMs, they have been. Many may ask, why do we need additional government oversight? Everyone else in the healthcare equation has oversight. The manufacturer of the medicine, the wholesaler who distributes the product, the pharmacist who dispenses it, the doctor who writes it, even the insurance company who bears the risk, all have oversight. Yet the pharmacy benefit manager who is playing games with Arkansas citizens and the dollars of our health care do not have sufficient oversight. They operate behind a curtain of secrecy. And I want to show you just a few examples of what happens when the fox guards the henhouse. I'm going to start with Christie on the end. APA was able to obtain pricing data that shows how CVS Caremark, the PBM for Blue Cross Blue Shield, pays itself at a far higher rate than it pays the independent pharmacies in Arkansas. In this particular example, the independent pharmacy for the atypical antipsychotic drug Abilify was paid a grand total of $28.27, barely covering the cost of the medication. CVS set that independent pharmacy's price, but when they set their own price, they set it at over $500 for the same prescription. This is, number one, a violation of Arkansas law, but more importantly, it is an unconscionable and unethical act of overpaying one provider themselves while paying a staggeringly smaller amount to other providers. It's almost unbelievable. The next example I want to show you involves a life-saving cancer drug called Timidar. Dr. Aker, if you turn that one around. The independent pharmacy who filled the prescription for Timidar was paid $909 for this very expensive medication. The PBM CVS Caremark paid themselves over $3,900 for the same prescription. This is an example of blatant self-dealing, and this abuse of the healthcare system has got to be stopped. This is artificially driving up the cost of healthcare for the patients of the state of Arkansas. The premiums that you all pay are being driven up by this, and at the end of the day, independent pharmacies are being underpaid. We're scratching around for nickels and dimes, while $100 bills are being thrown around by CVS to themselves. Now, APA also didn't just look at these two drugs. We were able to obtain a market basket of over 270 of the top prescribed and dispensed medications in the state of Arkansas. What the data reveals is that CVS pays itself over $60 per prescription more than it pays Arkansas's independently owned pharmacies. Ladies and gentlemen, that is self-dealing at its finest, at the expense of people who live here, who work here, who pay taxes here, and who take care of Arkansas's citizens. It is flat wrong. The fight... The fight over fair payment is crystal clear. CVS is paying independent pharmacies below their cost to devalue their businesses to try to swoop in and buy them on the cheap. Such a practice is anti-competitive and wrong. And it's also not just supposition. Dr. Bethay is going to turn around a letter that CVS has been sending around to independent pharmacies around the state of Arkansas since these dramatic reimbursement cuts have taken place. They are trying to swoop in after cutting the reimbursements down to the bone to put people out of business. And it's time for the insurance commissioner to have the proper oversight to oversee this practice. The legislation that Senator Ron Caldwell and Representative Michelle Gray have proposed is reasonable and it's common sense, and it has been carefully crafted. And I want the pharmacists to hear this. Right now, we think the pendulum has swung all the way this way. It is not our goal to swing the pendulum back the other way. Pharmacists are not about retribution. We are about fairness for our patients and for our business. We just want the pendulum to be in the middle where there is a fair and equal playing field for all of us to play on. And that's what this legislation that Senator Caldwell and Representative Gray have drafted has done. So what I would tell you, my fellow pharmacists, and to the patients around the state, we need this legislation. And what we also need to do is we need to thank our legislators who have stood up for the patients of the state of Arkansas, for the taxpayers of the state of Arkansas, for the pharmacists of the state of Arkansas. And we need to ask them in an absolute, genuine and polite way to support the legislation in the special session. I know you all will join me in doing that and thanking them. And